We want to talk about the importance of mammograms in early detection. Lauren Evans, mammographer with Cone Health Imaging at MedCenter Mebane, is with us. All right, so let's just talk about the baseline thing. Let's just talk about how mammograms help folks figure out what's going on and why that is so important.
So mammograms help find breast cancer before it can cause any symptoms. So it's very important to remember, early detection is what's going to save lives and give you more treatment options. So it's very important.
All right, so let's talk about this, because a lot of people talk about screening mammograms and other people say they're diagnostic mammograms. Which one are people referring to when we hear, hey, go get your mammogram?
So that would be just your screening or your annual mammogram. That's your yearly mammogram. Now, the diagnostic is when there's an issue with your breast. If you felt something, maybe your doctor felt something, that would be when you would need to get a diagnostic mammogram.
Okay, so screening is what we do every single year like normal, but if you feel something in between that, you're going to get a diagnostic mammogram. Okay, what are the recommended ages to start getting a screening mammogram? Because, I mean, you're hearing stories about younger and younger women getting breast cancer.
Yes, so we follow the recommendations by the American College of Radiology, and their recommendation is at age 40. But if you were to have any problems, say before age 40, it's definitely a good idea to have that checked out by your doctor to just be sure.
All right, and then what about, like, if you do have a family history, you've got a mom or you've got an aunt or you've got a grandmother that had breast cancer, does that change when you should start getting your mammogram?
Yes, if you have a strong family history of breast cancer, or other reasons to think you may be at high risk, it's always good to talk with your primary care doctor about this, and that way they could possibly do a cancer risk assessment. And ideally, you would have that before the age of 25. And if your calculated risk of that is over 20%, then you should start screening mammograms early.
And this is one of those things where you really do need to be talking to your family about that. So many family members like to keep things quiet.
Yes, it is very important to share that information with your family so they're aware if they need to be going earlier to get checked out.
Okay.
It's very important.
All right, we're going to continue on with our talk about breast cancer, mammography, early detection, what it's all about, what happens, all that kind of thing. We'll be back in just a few moments.